Have you ever experienced a numbness, tingling, or weakness in your hand? You might be dealing with carpal tunnel syndrome. Carpal tunnel syndrome, or CTS for short, is a common condition that affects millions of people worldwide. It occurs when there's too much pressure on your median nerve, the nerve in the wrist that allows feeling and movement to parts of the hand. To understand why this pressure causes such discomfort, let's take a closer look at the structure of the hand. The carpal tunnel is a narrow passageway located on the palm side of your wrist. This tunnel is surrounded by bones and ligaments and protects the median nerve, which runs from your forearm into the palm of your hand. The median nerve controls the feeling in your thumb and all your fingers except for your pinky. Now imagine this tunnel as a highway, and the median nerve as a car driving through it. When the highway is clear, the car can move smoothly and without interruption. However, when this highway becomes congested or narrows down, the car, or in this case, the median nerve, experiences pressure. This pressure on the median nerve is what leads to the numbness, tingling, or weakness in your hand, which are the common symptoms of carpal tunnel syndrome. It's essential to stress that CTS is not just an office worker condition. While it's true that repetitive motions like typing can lead to CTS, it can affect anyone regardless of their profession. It can be caused by anything that makes the carpal tunnel space smaller or increases the amount of tissue in the tunnel, causing compression of the median nerve. So, if you've ever woken up in the middle of the night with a numb hand, or you've felt a tingling sensation while driving, you might be experiencing the early signs of carpal tunnel syndrome. Now that we understand what carpal tunnel syndrome is, let's delve deeper to understand its causes. An understanding of the causes of carpal tunnel syndrome can help in prevention and treatment. Let's delve into the various factors that can lead to this condition. One of the most common causes is repetitive hand and wrist movements. This might be part of your job, a hobby, or even daily tasks. Activities that require prolonged gripping, bending of the wrist, or vibrating hand tools can strain your median nerve, leading to carpal tunnel syndrome. But it's not just repetitive actions that can be culprits. Pregnancy is another factor. Why, you may ask? Well, during pregnancy, hormonal changes can cause swelling and fluid retention, which can put pressure on the median nerve, leading to symptoms of carpal tunnel syndrome. Certain health conditions can also increase the risk. Diabetes, for instance, affects the body's nerves, making them more susceptible to compression. Rheumatoid arthritis, on the other hand, can cause inflammation and swelling in the wrist, which can compress the median nerve. Other conditions like hypothyroidism, obesity, and high blood pressure are also known to increase the risk. Genetics can play a role too. Some people are born with a smaller carpal tunnel, which leaves less room for the median nerve. This can make them more likely to develop carpal tunnel syndrome. Let's not forget about age. As we grow older, our nerves become less elastic and more susceptible to damage. This can make older adults more prone to developing carpal tunnel syndrome. And finally, lifestyle factors such as smoking, sedentary behavior, and a high-salt diet can also contribute to the condition. Smoking reduces blood flow to the median nerve. Sedentary behavior can lead to weight gain and increased pressure on the nerve, and a high-salt diet can lead to fluid retention and swelling in the wrist. It's clear that a wide variety of factors can contribute to carpal tunnel syndrome, and understanding these causes is a crucial step towards prevention and treatment. Knowing the causes can help us mitigate the risk, but what are the symptoms to watch out for? Recognizing the symptoms of carpal tunnel syndrome is the first step towards getting appropriate treatment. Carpal tunnel syndrome, a common condition that affects the hand and wrist, manifests itself through a range of noticeable symptoms. The most prevalent of these symptoms is numbness. This sensation, often likened to a pins and needles feeling, typically affects the thumb, index, middle, and ring fingers. It can occur at any time but is most commonly experienced during the night or in the early morning. Another symptom that many individuals with carpal tunnel syndrome experience is a tingling sensation in the hand. This can feel like a mild electric shock traveling from your wrist up your arm. Like numbness, this tingling can be more pronounced during periods of rest or inactivity. A less common, but still significant symptom, is weakness in the hand and wrist. This can lead to a tendency to drop objects or find it difficult to perform tasks that require a firm grip. In more severe cases, this weakness can extend to the forearm and elbow. Lastly, some people may experience pain in their hand and wrist. While not everyone with carpal tunnel syndrome will have this symptom, for those who do, it can be quite debilitating, affecting their ability to carry out everyday tasks. In summary, numbness, tingling, weakness, and sometimes pain in the hand and wrist are key indicators of carpal tunnel syndrome. Once we identify these symptoms, what are the possible treatments? There are multiple ways to treat carpal tunnel syndrome, ranging from lifestyle changes to medical interventions. The first line of defense against carpal tunnel syndrome is often simple lifestyle adjustments. Ergonomic improvements can make a world of difference, whether that's altering your keyboard setup at work or modifying how you perform repetitive motions. Mindful breaks from continuous activity and gentle wrist exercises can also help alleviate symptoms. Now, if lifestyle modifications don't alleviate the pain, wrist splinting may come into play. This method immobilizes the wrist in a neutral position to minimize pressure on the median nerve and is often most effective when worn at night. When the condition progresses, or in cases where pain is severe, medications may be recommended. Over-the-counter non-steroidal anti-inflammatory drugs, or NSAIDs, can help reduce inflammation and pain. Corticosteroids, either taken orally or injected directly into the wrist, can also provide relief by reducing swelling and pressure on the nerve. But what if these treatments aren't enough? In severe cases, surgery might be the answer. This procedure involves cutting the ligament around the wrist to reduce pressure on the median nerve. Though it's a more drastic solution, it can provide long-term relief for those with severe carpal tunnel syndrome. Now, it's important to remember that each person's journey with carpal tunnel syndrome is unique. What works for one person may not work for another, and it's crucial to consult with a healthcare professional to determine the most appropriate treatment course. Among these treatments, let's focus on a non-surgical and effective option: the Dr. Arthritis copper-lined wrist brace. This innovative tool works by providing gentle compression and support to the wrist, helping to reduce inflammation and alleviate pain. It's a simple, non-invasive solution that can be used in conjunction with other treatments. But more about that in the next scene. Stay tuned. The Dr. Arthritis copper-lined wrist brace is an effective non-surgical treatment option for carpal tunnel syndrome. This innovative brace is designed for comfort and adjustability, ensuring a perfect fit for everyone. The copper lining is not just a chic detail, it holds therapeutic benefits. Copper is known for its anti-inflammatory properties, potentially providing additional relief to your aching wrist. It's not just a brace, it's a companion for your wrist, offering support and alleviating discomfort. In summary, understanding carpal tunnel syndrome can help in early detection and effective treatment. Carpal tunnel syndrome is a common condition that can be managed effectively with the right knowledge and tools. From understanding its causes and symptoms to exploring various treatment options, we've covered it all. Remember, the Dr. Arthritis copper-lined wrist brace is a stellar tool in managing this condition, offering support and relief. We invite you to join our community and stay tuned for more insightful health-related content. Don't forget to check out the link in the description to get your Dr. Arthritis copper-lined wrist brace today.